I'm now joined by expert in communicable diseases, Dr. Bharat Pankania. Bharat, afternoon to you. Thanks for being with us. So here we have another day, another grim milestone, record positive tests.
It's very worrying because the trajectory, although stabilizing, is still in its upward direction. And I just hope that we don't go on losing more and more lives in the coming months.
An increase in that statistic concerning testing, but that does suggest that we are testing more. That's surely reflected in those figures. But there again, a day after 50,000 confirmed deaths, there's just simply no good spin on this.
No, I mean, we are finally releasing a lot of testing capacity, but this is grim reading. And the intelligence from my friends, colleagues all over the countries is that hospitals are getting busier and ITUs are also getting full. And more importantly, also that there is a lot of Black ethnic minority Asian groups, vulnerable groups also in hospitals. So it's all very concerning that we have vulnerable people with illness.
And what about then addressing that issue? Is enough being done to help the BAME communities, those vulnerable people in society, combat this?
We can do more and we need to do more. So every employer needs to profile all their workers, not necessarily Black, Asian, ethnic minority people, but all people, and create a map for them. In other words, if they fall into a vulnerable category, then don't put them in face-to-face fronting jobs, such as, if you are in a clinical setting, you need to have proper PPE, otherwise sit in the back room doing other work. It's those sort of measures in all employment that we must undertake.
And we do have good news about a potential vaccine, looking very positive, but the government's rolled back on promises to prioritise the BAME community. Well, who do you think should be the top of the list then?
The top of the list will be people who are vulnerable. So that is the older age groups. And on top of that, we need to also immunize people in the front line. And then one more thing, thinking outside of the box, is we try and have a program of immunizing people who are what we would call super spreaders, people who are very active, who are out and about. And if you are able to capture that group and immunize them very, very quickly and very efficiently, that also reduces the level of circulating virus in the community. And therefore, even if you haven't got around to immunizing the elderly, the vulnerable in their homes, because the level of virus circulating in the community has been brought down, it has a benefit for them too. So that's thinking outside of the box, not only going by categories, elderly, old, infirm, diabetes, frontline staff, but also people who generate an increase in number of cases. Who are they? The 20 to 50-year-olds. And we should have considerations of rapidly immunizing this subgroup as well.
And Bharat, talking about preventing the circulation of the virus among communities, what about this other measure we're hearing about, COVID freedom passes? Could they open up society or perhaps there are concerns, create division, the haves and have-nots, as it were?
I think whilst the thought processes are welcomed, I don't think they have thought this throughout properly, because you really don't know who is protected, not protected, recovered, fully recovered, susceptible to subsequent infection. And by the way, the same applies to just because you don't have detectable antibodies doesn't mean you're not immune. So there are a lot of conundrums with respect to who do you identify as impervious to infection and therefore safe, and who do you classify as possibly likely to get reinfected and therefore not safe. It's not that easy.
Dr. Bharat Pankania, thank you very much indeed for joining us live. Always good to talk to you live here on RTK. Thank you.